Alright, here we have a picture of the spine, both in a lateral view here and an axial view. And we have a herniated disc right there, and you can see it right there. And we're going to talk about this and how it is affected, how it affects the nerves, and how we treat it with spinal decompression. As you can see right here, we have this disc. This disc, that's when you hear people that say they slipped a disc, or they injured a disc, or they have a herniated disc. This right here is a ligament that runs along the back of the spinal column, and then in this area is the spinal cord. Okay, they don't show it here, but over here you can see the spinal cord located here. Then this represents the nerves coming out of the spinal cord. Those are spinal nerves. And when you have a disc injury, it can be pressing here, here, or here. So we'll go ahead and play this video now so you can just see it moving. Here we're seeing this starting to push out, and here we're starting to see this breakdown, this degeneration as it's pushing out on that yellow ligament there. So there we go. We now have this area around here called the annulus fibrous pushed out, and the nucleus pulposus is pushing as well. This is a left a lateral. Right lateral is just going to be the opposite side. Same thing, going out towards the right side, pressing upon that ligament. Central, and there we see. This can cause all sorts of things. This can cause sciatica, people will say, that feeling down the leg, not to be confused with sciatica caused by piriformis spasming. But this can cause any types of symptoms down the arms or down the legs or whatever. This specifically is a lumbar spine, so it's going to be down the legs or into the gluteal area. Here we have a herniation fragment, so we'll look at this one as well. Here you have a tear right there in what we call the annulus fibrous, a tear. And then now we have nucleus pulposus literally leaking out into the canal. And the central one, again, we'll do that one. This is coming straight back, and it's going to press upon the spinal cord itself. Usually, depending on, the severity of these can definitely be affected, but depending on having left or right, that may give some symptoms down the leg. So if it's all right, it may go down the right leg. If it's posterior lateral, it may be affecting, the spinal cord and the nerve itself, and be causing pain in both areas. So what we do for this is we do a treatment called decompression, where we lie somebody on a table, we strap them into basically like seatbelt material, a little bit thicker than that, and we pull apart. So we take these straps and we pull axially, meaning we pull the body apart, or we open up the lumbar spine, and what we do is start pulling it apart in this direction. So we slowly pull it, and as we're pumping it, and you can just look at the left side of the screen there, that's literally what we're doing. Pulling, relaxing, pulling, relaxing, pulling, relaxing. And as we do that, we get more liquid, more moisture into the area, and we start building this back up. We do lots of other rehab along with it, but generally decompression is opening this space back up to take pressure off this. We may not get this to return to look like the other ones, but we do a lot of things to help get people to the point where they're no longer in the pain that they were before. Please go on to our website on our Facebook page, click a link, and make an appointment. We do virtual appointments. I'll do an appointment over the phone. I'll do a web appointment, and I'll even get you into a clinic that can do a face-to-face meeting with you. I hope you enjoyed the video. Thanks.